Why does chemo still cause nausea and vomiting? Imagine fighting cancer with powerful drugs that can sometimes make you feel worse before you feel better. Chemotherapy is a vital treatment for lung cancer and many other cancers, but it often causes nausea and vomiting. So why does this happen even with advanced medicines designed to prevent it? The answer lies in how chemotherapy interacts with your body's nervous system and digestive system. When chemotherapy drugs are given, they activate specific pathways in both the gastrointestinal tract and the brain that trigger the vomiting reflex. These pathways involve complex interactions between the drugs and neurotransmitters, which are chemical messengers in your nervous system. One of the main players is serotonin, a neurotransmitter that is released by special cells in the lining of your gut called enterochromaffin cells. When chemotherapy stimulates these cells, they releases large amounts of serotonin. This serotonin then activates receptors called 5-HT3 receptors on nearby nerves. These nerves send signals through the vagus nerve to your brainstem, which is the part of your brain that controls nausea and vomiting. This process is responsible for the immediate or acute nausea and vomiting that often happens within the first 24 hours after treatment. But serotonin isn't the only neurotransmitter involved. Dopamine and substance P also play important roles. Substance P activates neurokinin-1 receptors in the brainstem, contributing to nausea that can happen more than 24 hours after chemotherapy, known as delayed nausea. Dopamine receptors are also part of this complex signaling system. Despite the development of anti-nausea medications that target these pathways, such as drugs blocking serotonin and neurokinin-1 receptors, completely preventing nausea and vomiting remains difficult. This is because multiple pathways and neurotransmitters are involved, and each person's response can be different. For example, younger patients, women, and those with a history of morning sickness or anxiety may experience more severe symptoms. Other factors that can make nausea worse include damage and inflammation of the gastrointestinal lining caused by chemotherapy, which can increase neurotransmitter releases and sensitivity. Psychological factors also matter. If someone has had nausea before, they might anticipate it and experience it more strongly, a phenomenon called anticipatory nausea. Additionally, dehydration, electrolyte imbalances, and other medications can influence how severe nausea becomes. In lung cancer treatment, where chemotherapy often plays a key role, managing these side effects is crucial for keeping patients comfortable and helping them stick to their treatment plans. Current anti-nausea protocols use combinations of drugs to block different pathways, including serotonin and neurokinin-1 receptors, along with corticosteroids to reduce inflammation and nausea. Still, because the mechanisms behind chemotherapy-induced nausea and vomiting are so complex, some patients continue to experience symptoms despite these measures. In summary, chemotherapy causes nausea and vomiting because it activates multiple pathways involving serotonin, dopamine, and substance P in both the gut and brain. The complexity of these processes, along with individual differences, means that current treatments can help reduce but not fully eliminate these side effects. Ongoing research is focused on better understanding these pathways and developing more effective supportive care strategies. If you or someone you know is experiencing persistent nausea during chemotherapy, it's important to talk to your healthcare team. They can tailor treatments to help manage these symptoms and improve quality of life during cancer therapy.